The coronavirus outbreak has added stress to caregiving. So what are some of the mental health tips caregivers need during the coronavirus? Hi, I'm Ros Jones, the CEO and owner of Jacksonville's Best Caregivers, where we provide 4 levels of specialized care to your loved ones: sitter, homemaking companion, home health aide, and certified nursing assistant. When you can't do it all, give us a call. As many of us know, in 2020, the coronavirus has added stress to everybody. But particularly for caregivers, it has taken the stress level to another level. So I have a list of tips that has been given to me by some friends that will help you maintain your mental health during this coronavirus while you're taking care of a loved one. So let's start with tip number 1. You need to maintain a regular daily routine and lifestyle. Number 1, you need to maintain a daily routine and lifestyle. Oftentimes when we come into stress and we are having difficult times, regularity is the thing that helps us get through stress. Being regular, doing things on routine, having a to-do list, a checklist is just one of the things that can help you maintain a routine. Okay, journaling helps you routine. Having a calendar, having a to-do list. These things that you were doing prior to the virus are some of the things that's going to carry you through the virus and reduce the stress. Number 2, improve your sleep. As a caregiver, I know that this is in short supply, honey. Yes. I don't know how I say improve your sleep because, I get very little sleep, but sleeping, as I have talked about before, so far as self-care, improve your sleep. And so that's number 2. You got to get your rest. You have to sleep in order to reduce the stress. Sleeping allows the body to reset and to prepare for the next day. So lack of sleep increases stress, increases anxiety. The more sleep you get, it allows your body to reset and to be able to prepare for the next day. Tip number 3, focus on what you can control and limit and what if thinking. Focus on what you can control and limit what if thinking. Don't worry about the things that you don't have control over. You can't worry about that. And all this what if. All you can do is try to have a contingency plan, have a backup plan, and that's the best that you can do. You have to be able to be flexible as a caregiver, okay? So you have to be able to be flexible. So focus on what you can do and limit those what ifs, okay? That's tip number 3. So now let's go to tip number 4. Ready? All right. Number 4, lighten up on yourself. The pandemic has changed our lives. It really has. It has changed our lives. So lighten up. Yes, we have to stay at home. Yes, we have to wear masks. Yes, we have to practice the social distancing. We have to follow the footprints in the stores, the arrows and all of this. But don't make it so hard on yourself. Make the necessary adjustments. Lighten up. If you can't, like the other day, I went down the aisle and the arrow was pointing this way, but I was coming against the arrow. And I laughed at myself. I said, oh my God, I'm going in the wrong direction. And it was funny because the other lady said, well, I do it all the time. I wish they would pick up these arrows and these feet thing off, the social distancing off of the ground. But it was a joke. So, don't be so hard on yourself if you make a mistake during the pandemic. We were making mistakes before the pandemic. Lighten up. Don't be so hard on yourself. Don't be a perfectionist. Don't try to be a perfectionist. This is not the time for that. It's really not, okay? So the next tip is tip number 5. In case you get sick, either with the virus or anything else, plan for someone to be able to take care of your loved one. If you get sick, plan for someone else to take care of your loved one. This is what you need to be focused on. This is what you need to look at. If I get sick and, I can't come home, I'm going to be in a hospital or quarantine or whatever, then you have to say, all right, either I'm going to have to hire a private duty caregiver, I'm going to have an agency, or family's going to have to come in. Or what you may have to do is look into what nursing homes can take your loved one for a couple of weeks until you get over the virus. So, those are some of your options. You have to plan for, in case you get sick, who is going to take care of your loved one. Tip number 6, how else can you take care of your mental health as a caregiver during the pandemic? Tip number 6 is take mini breaks. During the day, just pull back. Stand up from that computer. Get off of that computer. You're supposed to stand up from the computer every hour anyway. Come away from the computer. Journal. Go for a walk. Close your eyes. Listen to meditation. Listen to some music. Read a book. Do mini breaks. That will allow you just to kind of, relax and reset. So taking mini breaks is just as important as sleeping. Okay. Tip number 7, and I've talked about this before. Tip number 7 is remember that you are not alone. Remember that you are not alone. And a lot of times when we start doing caregiving, we start isolating ourselves, and no one else is going to help, and so on and so forth. That's because we have not reached out. There are support groups out there. There are nonprofit agencies. There are adult daycare, like I have talked about in previous YouTube videos that I have presented to you all. There are a lot of resources and agencies out there that will help you, but it's up to you. Number 8, use humor to relieve tension. Use humor to relieve tension. Watch a comedy. Listen to some comedians on YouTube. Go to a comedy show. Watch a funny movie. Laughter, humor, use humor to relieve the tension. Use humor to relieve the tension. This is so important. You will be amazed at, when you start laughing or looking at something funny, you will be amazed at how much of the stress just leaves your body. It just leaves your body. Let's just recap. I love to do a recap. So let's just recap really quick those 8 mental health tips for caregiving during COVID. Number 1, maintain a regular routine and healthy lifestyle. Number 2, improve your sleep. Number 3, focus on what you can control and limit the what ifs. Number 4, lighten up on yourself. Okay, don't be so hard on yourself. You don't have to be perfect. Number 5, plan for your older adults' care in case you get sick. Number 6, take mini breaks. Take little mini breaks. Number 7, remember you're not alone. There's people out there that can help you, but you have to ask for help and you have to look for the help. Okay? And number 8, use humor to relieve the tension. So these are just a few of the mental health tips that will help caregivers during COVID. If there's some other tips, of course, that I have missed, I always say, please put it in the comment section. Or if there's a video that you would like for me to do, please let me know. Also, too, in the comment section. Don't forget to like, share, and subscribe right down here at the bottom. And remember, I am Ros Jones, the CEO and owner of Jacksonville's Best Caregivers, where we provide 4 levels of specialized service to your loved one: sitter, homemaker, companion, home health aide, and certified nursing assistant. When you can't do it all, give us a call. And once again, thank you so much for subscribing. Thank you so much for turning on your notifications and to be able to watch the videos. I look forward to seeing you again in the next video. And thank you for taking the time to watch and allowing me to come into your space for these few minutes. Talk to you next time. Bye.